We are continuing our discussion on the coronavirus or COVID-19 pandemic. And with new case numbers on the rise throughout the country, the numbers continue to hold steady here in Florida. And this leaves many residents questioning what they should do next. Well, face masks are required throughout many Central Florida communities, and more testing sites are opening to accommodate the numbers. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Our first guest is the very busy Orange County Mayor, Jerry Demings, to give us an update on what's going on here in Orange County. Mr. Mayor, thank you for joining us.
Well, thank you for having me, and I always look forward to being on the show with you. I hope you've been safe, and I hope your family's been safe during this unprecedented period of time that we're living in during a pandemic.
Yes, sir. Yes, sir. Where are we in controlling the spread of coronavirus here in Orange County? What does that look like?
We have seen a deceleration of the virus within our community, and I believe that that is primarily related to the increase in the wearing of facial coverings, a mask here within our community, coupled with businesses really embracing all of the various CDC guidelines that have been recommended. As a result of it, and within the last 14-day cycle, we have seen our rate of positive new cases decline to under double digits. Many of the healthcare experts and researchers around the world say that if you can contain the virus to 5% or less, you have essentially done the job of containing the virus within your community. And so we had the lowest on Thursday of this week, the lowest positive rate that we've seen in really about 8 weeks. And so that's good news for our community. We are below the double digits, so we are like 9.9% for the 14-day period of time most recently. So that's really a good news for our community as we endeavor to push these numbers down. So I don't want our citizens to let up. I want them to continue really adhering to the social distancing guidelines, the wearing a mask, etc., because that's truly going to contain the virus. But we also know that in-person public schools will be opening this week, and so that is going to create another opportunity there. There's some, I think, anxiety associated with going back into schools, both by the students as well as the faculty on those various campuses. So it's going to be really important that as schools reopen, we continue to work to keeping the virus from spreading within our community.
And how about testing efforts here in Orange County? Are we still testing at the same levels we've been doing over the past couple of months?
We are still offering free testing at various sites, east and west and central to the county itself. We're partnering with some of the municipalities as well as some of the private care providers like Central Care and some of the others here within this community to ensure that testing remains available. I will tell you that we have seen a drop off in the number of individuals who are being tested on a day-to-day basis. There's still the regional testing site that's free at the Orange County Convention Center. They have expanded the eligible people who can be tested to include children who are 12 and older. And so that's something that's new. The state has recently deployed mobile testing units that can move throughout a particular area within the different regions around the state. That mobile unit spent some time recently here within Orange County, and then it's moving throughout the other Central Florida counties as well. So there's still testing available. If one wants to be tested, there's no reason why you can't get tested and get it done for free.
And so many people here in Orange County have lost their jobs because of the pandemic. What is the new COVID-19 eviction diversion program?
On August the 25th of this year, we will begin the process of taking applications for eviction diversion. It is a program that is designed to both benefit the landlord and the tenant. And in order for landlords and tenants to be eligible, there has to be a written contractual agreement between the landlord and tenant. And we want individuals who, first, they have to be residents of Orange County, living in Orange County, with some type of lease agreement. They have to be 2 or more months in arrears and paying their rent. And then there has to be agreement by the landlord that if we enter into these agreements that will be facilitated through the Orange County Bar Association and Community Legal Services. Through those particular agreements, the parties agree that the landlord will avert the eviction process for at least 60 days, and preferably through the end of the year.
Excellent. How about the new strike team? What is that, and how is that program going?
The strike teams that we put in place are really in place to gain compliance from our businesses that reopen under strict guidelines in some cases as a result of the governor's executive order. And we want to ensure that those businesses have all of the CDC protocols in place to keep both their employees and the patrons of their businesses safe. So in order to ensure that the businesses are following the guidelines, what we did here in Orange County was assemble a team of experts that come from Orange County proper, code enforcement, healthcare workers, building officials, and Department of Health officials will go out and inspect these various businesses to ensure that all of those guidelines are being followed. If the guidelines are not being followed, essentially the business is warned. We provide the business with informational items. We provide them with personal protective equipment if necessary, and we give them guidance. And we then give them a period of time by which to comply, and we go back and we re-inspect that business at some point. And all of these are essentially unannounced visits, and they're designed to gain compliance. If we find that businesses aren't compliant, then we look to the various regulatory authorities that may have some regulation over that particular business. For example, if it's a restaurant that is licensed through the Department of Business and Professional Regulation, they may be subject to review by DBPR. If they're a licensed restaurant with a liquor license, then in some regards, Department of Business and Professional Regulations, alcohol and beverage enforcement may have some authority over the alcohol beverage license for said business, and that business can be potentially faced with a suspension of their beverage license itself. And then in other regards, the business might have some regulatory oversight by the Department of Health, and there could be sanctions that will be put in place from any of that. And then in some other cases, there may be criminal sanctions. And so what we're saying here is that we're going to use the breadth of the government's authority to ensure that these businesses remain compliant.
And Mr. Mayor, you mentioned earlier that kids are going to start going back to school. We are headed into a Labor Day weekend. What advice would you have for Orange County residents about maintaining the progress that we've already got through these challenges?
What I would say is, as we see more businesses reopening, as we see our schools reopening, the schools have gone through a review by a volunteer medical team, as well as a review by the Department of Health to ensure that their plans are sufficient to keep the children and the staff safe. But I do believe that none of this can work if we don't have parental support. The school district has indicated to me that they expect that as school reopens here within the next week, that they will open with about 30% of the students returning to campus. That means that 70% of the students are going to continue distance learning through some type of virtual format where they will be at home or some other location. But with 30% of the students on campus, that gives the classroom teachers and staff the opportunity to socially distance the students. But those students need to go to school prepared. That means that they need to have their mask, and they need to have perhaps a bottle of hand sanitizer in their book bags, and they need to understand what they need to do while interacting at school itself. So in order for us to have success, everybody has to play a particular role, an important role in having success for safety here within the community itself.
Well, Mayor Jerry Demings, thank you so much for being with us today and giving us that advice. And you stay safe as well, you and your family.
Thank you very much, and the same to you as well.
And we'll be right back with more. Stay with us. Now let's get an update from our local medical professionals, and joining me is Alvina, epidemiologist with the Florida Department of Health in Orange County. Thank you for joining us, Alvina. Tell us about the numbers here in Orange County. Are they rising or falling?
Sure. So over the last several days, we have seen a slight decrease in the overall total numbers of positive new cases here in Orange County, as well as a decrease in hospitalizations and a decrease in deaths. Particularly in our emergency rooms, we have seen a decrease in our tracking for influenza and COVID-like illnesses. And so all of this, we are cautiously optimistic about this downward trend at this time.
So are you, as an epidemiologist, thinking that this comes from behaviors, or is this just magically going to go away?
Well, if history tells us anything, nothing magically goes away, of course, but we're hoping that all of the messages that we've been pushing out, about you're wearing a mask to prevent yourself from infecting other persons, social distancing, so to help prevent the transmission of the droplets from person to person, and also good hand washing to help protect yourself from, transferring virus particles to yourself. We're hoping those messages, plus our measures put into place for businesses and schools and our other community locations, have reduced the amount of transmission in the community.
That's actually very good news. I know that with the kids going back to school, one of the things that you want to emphasize is the risk of multi-generational transmission. Tell us about what the concerns you have are with that.
Right, so as we can see from the distribution of the cases for the demographics of it, we can see that mostly it's younger persons or younger people who are the new cases. And then the people who are getting hospitalized are, your parents' age or maybe your grandparents' age. And then the persons who are most severely affected are our oldest family members. And so we can sort of see this trend where younger people are out and about, they have mild symptoms or mild illness, and they bring it home to perhaps their family, their parents and their grandparents, and then those family members who are at most risk for developing severe illnesses are the ones who are really feeling the worst effects of it. And so this is something we wanted to bring up, whereas, don't let up. We're in this downward trend, and we're in this lull right now, but don't let up because there is still virus circulating in our communities, as we can see from our community testing. Although there's a decrease, there are still persons who are positive in our communities. So this is what we want to really bring home as we allow, as we move into additional or increased measures with social interactions, such as in schools or in colleges or even with businesses.
The NBA has been playing here in Orlando in their bubble, that they call it, but they've been having some success with the rapid saliva tests. Are there some tests that are more accurate than others?
So actually, currently, the gold standard is the PCR, or the polymerase chain reaction test, which isn't necessarily a rapid test, although there is a rapid isothermal nucleic acid amplification test. I don't know if this is, but so there are some rapid tests that are available. The saliva test was recently just approved by the FDA, so we don't really have a lot of good data right now about its good sensitivity or its positive predictive value. But we're glad to see that the NBA has reported no positive cases.
How have the efforts in contact tracing been helping to get those numbers down as well?
So our greatest efforts are trying to get the message out to as many of the positive people as possible and their exposed contacts, to get the messages out there to primarily, number one, if you are sick, stay at home for at least 10 days after you feel your first onset of symptoms. And then also for persons who are exposed and who might be, waiting to see if they develop illness, to stay home for 14 days. And so that's based on from the time of exposure, last exposure to the positive person, sort of waiting to see whether or not you develop an illness, and that you self-quarantine at home away from others just in case you do. So we're hoping our efforts to try to reach all of those people in as short a time as possible is helping to reduce the amount of people who are, circulating out and about in the community who might be infecting others.
Alvina, thank you so much for being with us and keeping us informed from the front lines of this pandemic. We appreciate your time.
Thank you.
And we'll be right back with more. Stay with us. There's one population that's sometimes overlooked, especially during these unprecedented times, and that is those who are inside correctional facilities. And joining me is Chief Luis Quinones, Chief of Corrections in Orange County. Thank you, Chief Quinones, for being with us today.
Thank you for inviting me.
Tell us about, during normal times, about the corrections facilities in Orange County and what they look like as far as operations is concerned.
Well, we're the fourth largest jail in the state of Florida. Last year, we booked in approximately 37,000 inmates. And on a daily basis, we have programs that we run for the inmates. We understand the importance of providing those programs so those individuals could re-enter back into society better than they came in. Today, we have over 2,300 inmates, and 96% of our inmate population returns back out to the community. That's why we focus our efforts on re-entry, to get ahead and allow them an opportunity to get gainful employment upon their release. We also have over 2,500 individuals that are on supervised probation, and we have to make sure that we engage with them as well, because at the end of the day, our goal is to make sure that we, number one, run a safe and secure facility, but also protect the community because we are considered a public safety entity.
So with the coronavirus, how do you really control the risk of transmission in what is close quarters, to say the least?
Yes, absolutely. And we do a variety of things. The first thing that we do is when an individual is arrested, we put them in a unit with other individuals that are newly arrested for up to 14 days, or excuse me, a minimum of 14 days. And we do that before we put them in with the general population, because as you know, individuals could become infected with the virus in the community. And what we don't want to do is to spread it throughout the jail. Addition to that, any individual that comes into the correctional facility we go ahead and ensure that we take their temperature and that they have a mask. And we reduce the amount of inmate movement and unnecessary movement within the jail, so that way it doesn't, if the virus was to come in, it doesn't go from one place to the other.
And what has changed for corrections employees as it relates to this pandemic?
Well, the very first thing is before any staff member enters into the jail, they have to take a temperature check. It is required for every staff member to wear a mask while they're inside the jail, and social distancing is not possible. And those are the two big things. And one thing we tell staff right now is that if they are feeling ill, please do not come to work. Contact their supervisor, because we want to make sure that we minimize the spread. We also have staff that don't have immediate contact with the inmate population, and what they're doing is they're teleworking from home, and we're operating in that fashion as well. At the end of the day, we do not want to infect any inmate or staff members.
How about with visitors? Are inmates still allowed to get visitors from family members or attorneys while they're incarcerated?
Unfortunately, we had to suspend our video visitation for numerous reasons. Number one, the Video Visitation Center is a facility away from the jail, but the individuals from the community go to that area, and their carols are very close together. So we did not want to have the virus spread in that environment. We are working and have been working on a plan to reopen the video visitation. Also, where the inmates are to have that visitation, it's very close quarters as well. So at the end of the day, it is definitely my goal to open up our video visitation center as soon as possible. However, I need to make sure that when we do open it, that we have all the safety precautionary measures in place so that we don't cause anyone any potential risk to harm and anything of that nature.
And have there been changes in the way that inmates experience health-related services that are not related to the virus? I mean, just if they go because, they have an appendix issue or something like that. Has that changed as well?
Not at all. We continue to go ahead and offer medical services to our inmate population. That could never change. And but one thing that we do in relations to COVID is the moment an individual has flu-like symptoms, we immediately send them to get examined by our medical staff.
And is that the only measure that you're doing as far as trying to stop the spread inside of the jail? Are there other precautions that are being taken to really sort of stop the spread if someone were to be positive for the virus?
Absolutely. Well, all the precautionary measures that I mentioned already, we're doing that. We are enhancing our cleaning. We have added PPE throughout the jail to help protect our staff and minimizing the amount of movement of the inmate population. And if a person does test positive, we immediately move them to another unit where they can receive medical attention from our medical section.
So you're basically doing isolation or quarantine inside of isolation system, basically.
Absolutely, because those individuals that are symptomatic, we need to make sure we isolate them from the other individuals. And those that are asymptomatic, we're housing them together and monitoring them. So yes, we do have to isolate, based on that, and want to make sure that we don't continue to spread the virus.
Well, Chief Quinones, thank you so much for being with us today and giving us information that is affecting thousands of families throughout the county. So I appreciate it.
Thank you very much. And if I may, I just want to say, it's not easy, number one, running a jail during this time, but our staff are dedicated. They come to work and they're doing everything that we possibly can. And we just want to make sure that they don't get the virus from the jail and take it back to their family, nor do we want any inmates to be infected while they're in the jail. So kudos goes out to everyone for assisting me in minimizing the widespread of the virus that we're seeing in our community. I couldn't do it without my staff, and I just thank you very much for their efforts.
Yeah, well, we know that you're working to keep the community safe from your end, so appreciate your time. Thank you.
Thank you very much, sir.
And we'll be right back with more. Stay with us. Social distancing is one of the key components for reducing the spread of COVID and lowering your risk of contracting the virus. Yet, for many older adults who are living alone, social distancing can lead to feelings of isolation. With me is Ingrid Collins, AARP Florida Associate State Director of Community Engagement, and she's here to talk about their new Community Connections program. Ingrid, welcome, and thank you for being with us.
Thank you for having me.
Why is isolation of particular concern to older populations?
There are so many reasons, and I'll give you a few. AARP is particularly concerned about this because there are actually over 8 million older adults who are in the condition of feeling socially isolated. That leads to risk of poor health. It leads to all other kinds of negative effects. And to put it in perspective, I think these days we all are very familiar with the danger of smoking cigarettes. And it would actually take 15 cigarettes per day to cause an equivalent negative health effect as does prolonged social isolation. So that is just astounding.
Wow.
And why it's so scary.
And you know, when we think about isolation, we think about nursing homes and assisted living facilities, but how does it affect people who are still living in their home?
Well, yes, it's always been an issue in facilities, and sometimes it's a byproduct of longevity. Many times your peers have maybe moved on to other places. I mean, physically living in other places, or it could just be that you've outlived many of your closer friends and family, or your family is far away. And the interesting thing that's happening now with this global pandemic that we're all unfortunately sharing at the moment, this reality that we're sharing, means that it's not just limited to facilities like nursing homes and long-term care facilities and those kinds of care centers. It continues there, certainly. But really, the way I like to say it is, I don't know who would get away unscathed right now. I think we're all feeling it. And so if you think about the safety precautions that are recommended, that are physical distancing, so just to draw kind of a distinction between, physically distancing, staying 6 feet apart, or not going where it's not really critical that you go, and how that can lead to the feeling of social isolation. So in this day and age, yes, we have all these other virtual ways of connecting, but as a mother and as a grandmother, I can tell you that doesn't replace being up close and getting a hug from your grandchildren.
Yeah. And tell me about AARP's program to reduce isolation.
Yeah, so this is a wonderful program, and I'm so happy to talk about it and let people know about it. When the first stay-at-home order started, and we saw that the pandemic was getting just increasingly worse, and that people were really in need, and that for safety purposes, a lot of organizations like ours, like Meals on Wheels, like the food banks, where their services to people of older age or people who are in need, just anyone in the community, relies on these services. And yet the actual volunteers needed to protect themselves too. So what do you do? So Community Connections came out, and it's basically an online portal where individuals can go and look for mutual aid that is available in their area. And by mutual aid, we mean individuals helping individuals. That's really all it means. You heard on the news when somebody would get their friends together and let's go food shopping for maybe housebound people that are in our neighborhood. I mean, literally could be as small as a neighborhood, but then other organizations who typically did other services had to pivot and do different things. So we kind of generally call those mutual aid organizations and mutual aid assistance. But at the same time, it also created a place for somebody who had the great idea to list it there and find other like-minded individuals who wanted to help. There's lots of information there. It's a really great just landing place to talk about all of the information and resources that people need during this crisis. But one of the components is a Friendly Voices program. So it's under the umbrella of Community Connections, but it became this kind of little sidebar that turned into a much bigger thing, rightfully so. So Friendly Voices is we are empowering, training, and equipping the AARP volunteers who are interested in doing this to call people who need a call. And it is only a friendly call. It's not going to solve a lot of the problems, but right now that is the biggest problem, is just people who are feeling lonely. And so it just has taken off, and we were almost 1,000 volunteers just at launch that signed up for the training. Calls are recorded, there are safety measures. The volunteers know how to escalate if there is a crisis situation going on. But a lovely sidebar is that people are so gratified to get that call that they say, can you call me tomorrow? Can you call me at this time every week? And so it has turned into a scheduled check-in for many people who need it. And so I'm just so thrilled. It's a great program.
Yeah, it sounds great. That's like a buddy system. Very good. I do want to find out about a little bit more about the mutual aid groups. If an individual were to go online, do they have to form the group themselves, or are there groups already there? How does that work?
Yeah, so there are many groups already there because it's a nationwide portal. Here in Central Florida, I have had a few calls, and in some cases, the organizations who were providing help, if they were already, let's say, an established nonprofit, perhaps didn't see the need to list their organization twice, and that's perfectly understandable. So, there are some pockets of areas. As the site grows, you may go on there and see, oh, there isn't somebody offering this thing I need in this particular area. But it's supposed to be a holistic approach. So not only can an individual go and let me go see if what I need is there, a different individual can go say, I want to help, let me go put this there, and ask for other people to join me. So it's kind of trying to approach it from many different aspects. And yes, it certainly bears mentioning, as I said earlier, and understandable that there are many organizations that are doing amazing work and have done their own difficult pivoting of sorts to continue providing their services in the community. And we work with so many, I won't start mentioning because I don't want to leave anyone out. But AARP as a social mission organization is here to serve. We're here to serve our members, our communities at large, but that also means a lot of times assisting partner organizations with getting their message out and making sure that they continue to do their good works.
And what's been the feedback from those programs, the mutual aid groups and the community voices, the friendly voices? What's been the feedback from people who've experienced them?
It's just been amazing. One additional layer that was added to Friendly Voices was that Spanish language is now also offered, not just now, but shortly after the launch, they added the Spanish language option. Certainly here in Central Florida, we have a lot of Spanish speakers, as is the case all across the country. And so we just needed to make sure that we had the right amount of people trained, ready to go, and so that before we started taking the requests, that we were able to deliver on that service. So that's been a nice sidebar. But in general, actually, that simple act of someone saying, somebody cares, somebody out there cares enough to check in on me. I volunteered within the organization on some other projects that we have done where we do live Q&A calls relative to coronavirus. And it's an open line. So people who are participating on those calls can sometimes press a certain series on their keypad and be able to ask a question of the presenters. And so many times I would be the one screening the call and happen to get, several people who said, I don't have a question. I actually just wanted to hear a voice. I wanted to talk to someone. So if that doesn't convey the need that's out there and why this is so important and why it's so critical, and it's such a simple thing for many of us. I'm in a unique situation, like many others working from home. But yeah, we know that many people are unfortunately not employed. We have volunteers who, not all of them are retired, many are. But if they're staying safe, they still have the big heart they always had, and they want to help others. That's what led them to our door in the first place, to become an AARP volunteer. And that doesn't stop because they're home. And frankly, sometimes being able to talk to someone who has asked for help, it really kind of puts your own reality in perspective. If you're lucky enough to not have really critical, day-to-day urgent issues to deal with, then we can use this time. It's a gift of time in that regard, and we can help other people. So those are some examples of some amazing byproducts of this program.
Well, Ingrid, thank you so much for sharing that information on how we can support our elders through what is a difficult time for so many. Thank you.
Yes. Thank you for having me. I'm happy to talk about the program. Have a great day.
All right, you too. And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep you informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe.